Application of the nursing process. Breastfeeding. Interventions. Provide a quiet, comfortable environment. This would include pulling the curtain, placing a Do Not Disturb sign on mom's door. It's very important that mom is able to relax in order to be successful with breastfeeding. So you must assist with the first feeding, instructing her on the different positions, how to hold the infant, and the position of her hand. A C position is necessary with her opposite hand to place on her breast so that she is able to place the infant and the infant is able to have an appropriate latch. Latching on is accomplished when the infant opens his or her mouth and takes in the entire nipple. A sucking pattern is recognized when you can hear the infant say a ka or ah sound, and that is associated with swallowing. When the mother is completed breastfeeding after approximately 15 to 20 minutes on each side, to remove the infant from the breast, the mother must place her finger in the corner of the infant's mouth to release the suction. Frequency and length of feedings, typically every 2.5 hours, initially for 15 to 20 minutes per breast. In order to prevent problems, mom must allow her nipples to air dry. You must encourage the use of a supportive bra, and you must encourage mom to utilize different positions so that you don't prevent nipple trauma. Evaluation of this process is done when the infant appears satisfied, is sleepy, their hydration status is adequate, as noted in voiding adequate amounts in each diaper change, moist mucous membranes, soft flat fontanelles. It's important to encourage mom to breastfeed for at least 20 minutes per breast to ensure the infant receives not only foremilk, that watery first milk, but also hind milk, which comes at the end of the feeding and has an increased fat content. Please review box 22-2 on page 439 that includes the list of benefits of breastfeeding. These are different positions that are used for breastfeeding. This is the cradle hold. This is the football hold. Note mom has the infant's hand in one arm. The infant's buttocks is approximately at her elbow. And notice how in her left hand she has her breast in a C position to allow for an adequate latch on. This mother is using a boppy pillow to elevate the infant to a comfortable level so that she's not bending over, and that will decrease the incidence of back pain. This position allows mom to breastfeed at any time when she is taking a nap. So perhaps at night, this sideline position can be utilized if the infant is in a cradle kept right next to your bed. You merely lift the infant from the cradle, position them next to you, and you can breastfeed late at night without great disturbance. This is a very close view of mom with her right hand in that C position, and the infant, you can see, has a very good latch. So you can see from this picture the tongue movement over the sinuses, and that propels milk down the infant's throat. You can see that the lips are flaring outward, and note the extent to which the infant has the mother's nipple all the way in the infant's mouth, almost to the back of their throat. Common breastfeeding concerns, infant problems. Sleepy. The sleepy infant is not likely to breastfeed well. It's very important for the infant to be aroused to an awake state in order to be successful with breastfeeding. Nipple confusion occurs when the infant has been given formula with a rubber nipple or has been given pacifiers during the first month of life. There will be nipple confusion because a rubber nipple is much easier to suck on than the breast. Suckling problems. There are infants who may have suckling problems due to lack of coordination, and this takes trial and error in order to work through suckling problems with the infant. Infant complications of jaundice may cause an infant who is not as interested in feeding. Their activity level may not be that high. Prematurity, it is very difficult to get infants to breastfeed when they are premature. As I mentioned previously, an infant who is less than 34 weeks is unable to suck and swallow until they reach 34 weeks gestation. So prematurity and all of its inherent issues regarding development of the coordination of suck and swallow, as well as the development of the musculature of the mouth, prevents strong suck and swallow. So premature infants have difficulty with breastfeeding. Illness and congenital defects can also be problematic when assisting mom in breastfeeding. Encountering problems. The baby's 3 rules: feed the baby, protect mom's milk supply and spirits, and keep the baby breast-oriented. Feed the baby. Hand expression delivers more milk to the baby during the first few days than an electric pump, and this was noted by Ohiyama in 2010. Examples include cup, spoon, finger feeding, and tube feeding at the breast. The spoon works beautifully to deliver 10 to 20 drops every 1 to 2 hours on day 1. Used with late preterm infants and with a baby that won't latch. The preterm infant, we may utilize tube feeding and putting the infant at breast so that the baby associates latching, sucking, and swallowing with that sensation of the stomach being filled, so that they can then transition to successful breastfeeding. Hand expression. Press in a C hold about an inch behind your areola towards your chest. You can press the soft part of your fingers and thumb together, but don't slide toward the nipples. Relax, repeat, and then change sides. This can produce a small amount of milk, and when practiced, you may produce larger amounts of milk using hand expression. Most women typically prefer the pumping method, and the strong hospital-grade pump yields the greatest milk supply in my experience. Supply and demand. The body produces as much milk as the infant needs. Increased sucking gives increased milk production, and that is why we recommend to new moms that they put the baby to breast every 2 hours. Common breastfeeding concerns, maternal concerns. Breast problems. This can be sore, cracked nipples, and we need to address these immediately, otherwise mom may not have a successful breastfeeding experience. Sore, cracked nipples are painful, and if we teach mom to use different positions, we can minimize the chances that she will develop sore, cracked nipples. Illness in the mother. Mom can breastfeed through minor colds or minor illnesses. Medications. Please see Appendix A in your book regarding medications and breastfeeding. Breast surgery. Breast surgery may disrupt the neural pathways and ducts and the milk supply, so it's important if mom has had a breast reduction or if she has had any breast surgery, a breast enhancement, that you discuss the potential for problems with breastfeeding. Support her in any way and recommend a lactation consultant to provide ongoing support with breastfeeding. Employment. As I'd mentioned previously, employment can be a deterrent for breastfeeding success. It is the determined woman who goes to work every day with a pump and pumps religiously every 3 hours and has access to a quiet environment and a refrigerator so that she can continue to breastfeed her infant. Milk expression. Again, pumping every 3 hours allows for adequate milk supply. Storing milk. Breast milk should be stored in a clean glass or polypropylene container with a tight cap. A nipple should not be used on top of the bottle to store breast milk, as bacteria may enter that milk container. It should be used within 3 to 4 hours without refrigeration. Stored in a refrigerator, it is to be used within 72 hours. Freezing you can freeze breast milk, but you need to have the milk at below 0 degrees Fahrenheit. It may be used within 6 months. You need to know that freezing does alter the leukocytes in breast milk. Multiple births. Multiple births can be a concern for the breastfeeding mom. You can breastfeed twins simultaneously, one with each one in the football hold. It is difficult to breastfeed triplets or quads, although it is possible with the determined woman pumping, breastfeeding, and alternating different infants, A, B, or C infant, onto the breast for adequate breastfeeding. Weaning takes place. Hopefully, mom has a desire to breastfeed for 1 year, and at that point, the infant may be reluctant to continue breastfeeding, and mom may want to start the weaning process. And weaning takes place by stopping one breastfeeding session per day. And typically you would stop one breastfeeding session and then wait several days and then stop the second breastfeeding session so that you don't experience engorgement. Home care, there is the opportunity for a nurse to come and visit mom and provide home care services if she is having breastfeeding problems. Feeding success. How do we know if there is feeding success? There should be 1 to 2 wet diapers within the first 2 days, by 3 to 4 by day 3, and 5 to 6 wet diapers by day 4. There should be 3 to 4 bowel movements per day by day 3, 4 stools per day thereafter, and these are breastfed stools, and formula-fed stools, there should be 1 to 2 stools per day. The baby should seem satisfied after feedings and may fall asleep. The Well Baby Check notes consistent weight gain, and the infant doubles their birth weight by 6 months and triples in 1 year. We are looking for linear growth at this point, and that is the growth of not only weight and length, but also head circumference. Question. How can the nurse help the mother who is breastfeeding and has engorged breasts? The answer is D. Massage of the breast causes release of oxytocin and increases the speed of milk release. Engorgement is more likely to increase if breastfeeding is delayed or is infrequent. A well-fitting bra should be worn both day and night to support the breast. Cold applications are used between feedings to reduce edema and pain. Heat is applied just before feedings to increase vasodilation.